我们最喜欢的活动就是他们年轻人带我们2个老的去走走啊，讲讲话啊，讲笑话给我们听啊，这样给老人家开心一点啊。大家好，这个是我先生，我是他的太太。义工年轻人来，我很开心，安哥安弟很开心，他们很照顾我们2个老人家。年轻人来了，跟安哥有看那个血压高啊、糖尿病啊，跟他检查身体呀。
The couple, they were identified during admission to likely require hospital-to-home support. So they are in this H2H program. Thereafter, TriGen is this volunteer program that tags on with H2H. And we were a group that's assigned to this couple.
On a regular visit, we would first do a medical assessment on them to check if their blood pressure or blood sugar level are within the normal range.
We identified that he has got low motivation to exercise, as well as social isolation. We also identified that he has some issues with medication organization. Some of his medications in the pill box were disintegrated. That means that there's no medication effect when he takes them.
What we have done is we have come for several visits. This is our 4th visit, just to make sure that the transition from hospital to home is smooth and that they are doing well at home and that they have adequate support.
Today we did an activity of which we celebrated the Lantern Festival with them. So we actually taught them how to make a lantern as well as we ate mooncakes with them.
TriGen actually started in 2014 as a student-led project in a university when a group of friends came together hoping to serve the elderly and the youth. The project gained traction over the years, and in 2019, TriGen became a charity running intergenerational programs seeking to improve the health of the elderly and mentoring the next generation of youth to do the same.
The main concerns faced out by our seniors are really our population is aging very rapidly, and a lot of our seniors would increasingly have functional challenges at home. Likewise, their caregivers that are taking care of them are also getting more elderly. And last but not least, when they are discharged from hospitals, they may encounter unclear discharge instructions and they are not sure how to take care of themselves properly.
There are 3 parties involved: the youth, the adults, and the elderly participants. So you get 3 generations with 3 different perspectives. They all come to the same setting, they all contribute with their own input, and they take away something from it.
The TriGen Homecare Programme complements existing SGH population health programs by deploying healthcare volunteers to conduct home visits together by training with our youth. This allows us to complement our hospital to home as well as our community nursing teams and allow us to become more accessible to our patients even after office hours and during the weekends.
The goal of our training program is to help our adult volunteers to become better leaders as well as nurturers for our youth volunteers. To teach them how to become better health ambassadors for their own families as well as the community. So we have arranged for a whole day training program for all our adult volunteers and youth volunteers with these goals in mind.
What I enjoy most about the home visits is communicating with the elderlies in the TriGen activity. I get to work with my teammates, which is the team leaders and the other students. So it's a great experience for me as well, since I get to ask them questions from the team leaders as they are working in healthcare professional jobs.
Having to come down to the elderly house and doing this medical procedure on them hands-on, it really helped me to understand and learn the right procedure to perform on them.
The greatest takeaway I've got from joining TriGen is that you don't need to do a lot of big things to change or impact somebody's life. The smallest things that you do can also bring a lot of joy to someone that you barely know. The greatest good is really doing things for one another.